Kidney stones are a common medical issue that affects millions of people worldwide. These hard mineral deposits form inside the kidneys and can cause significant discomfort when they move into the ureter, the tube connecting the kidney to the bladder. Today, we'll explore how long it typically takes for a kidney stone to pass from the ureter, what factors influence this process, and what you can expect during this journey. Understanding the timeline and symptoms can help you manage your expectations and seek appropriate medical care if needed. Let's start by understanding what kidney stones are and why they cause pain. Kidney stones are solid masses made of crystals. They usually form when urine becomes concentrated, allowing minerals to crystallize and stick together. Stones can vary in size, from tiny grains to larger, more problematic stones. When a stone moves from the kidney into the ureter, it can block the flow of urine and cause intense pain, known as renal colic. The size and location of the stone play a crucial role in determining how long it will take to pass. Let's look at the journey of a stone through the ureter. The ureter is a narrow tube that connects the kidney to the bladder. Its main function is to transport urine, but when a kidney stone enters the ureter, it can cause a blockage. The ureter's muscular walls try to push the stone down toward the bladder, which can result in waves of pain. The stone's size and shape, as well as the ureter's diameter, influence how quickly the stone can move. Smaller stones tend to pass more easily, while larger stones may get stuck and require medical intervention. When a kidney stone is moving through the ureter, the most common symptom is severe pain, often felt in the lower back or side. Other symptoms include nausea, vomiting, blood in the urine, and frequent urination. The pain can come in waves as the ureter contracts to move the stone. Recognizing these symptoms is important, as they indicate the stone is actively passing. If pain becomes unbearable or is accompanied by fever, it's crucial to seek medical attention. Several factors influence how long it takes for a kidney stone to pass from the ureter. These include the stone's size, shape, and location, as well as the patient's hydration level and overall health. Smaller stones, less than 5 millimeters, often pass within a few days to weeks. Larger stones may take longer or require medical intervention. Staying hydrated can help speed up the process, as increased urine flow may help push the stone along. For stones smaller than 5 millimeters, the passage time is usually between a few days and a few weeks. Many patients report passing small stones within 1 to 2 weeks after symptoms begin. The process can be uncomfortable, but most small stones pass without the need for surgery. Drinking plenty of water and following medical advice can help facilitate the stone's movement through the ureter. Larger stones, especially those over 5 millimeters, may take longer to pass and are more likely to get stuck in the ureter. The passage time can extend to several weeks or even months. In some cases, medical intervention, such as medication, shockwave therapy, or surgery, may be necessary. If a stone does not move or causes severe symptoms, it's important to consult a healthcare provider for further evaluation. Drinking plenty of water is one of the most effective ways to help a kidney stone pass. Increased fluid intake boosts urine production, which can help push the stone through the ureter. Doctors often recommend drinking at least 2 to 3 liters of water per day during a stone episode. Staying hydrated not only speeds up passage, but also reduces the risk of new stones forming in the future. Pain from passing a kidney stone can be intense. Over-the-counter pain relievers like ibuprofen or acetaminophen are commonly used. In some cases, doctors may prescribe stronger medications. Applying heat to the affected area or taking warm baths can also provide relief. It's important to follow medical advice and avoid self-medicating with unapproved substances. If a stone is too large or causes complications, medical intervention may be necessary. Options include medications to relax the ureter, shockwave lithotripsy to break up the stone, or surgical removal. Doctors will assess the situation and recommend the best course of action based on the stone's size, location, and the patient's symptoms. Early intervention can prevent complications and speed up recovery. It's important to know when to seek medical attention. If you experience severe pain, fever, chills, or difficulty urinating, contact a healthcare provider immediately. These symptoms may indicate an infection or blockage that requires urgent treatment. Early medical intervention can prevent serious complications and ensure a safe recovery. Research shows that stones less than 5 millimeters have a high chance of passing on their own, with rates up to 90%. Stones between 5 and 10 millimeters have lower passage rates, around 50%. Stones larger than 10 millimeters rarely pass without intervention. Understanding these statistics can help set realistic expectations and guide treatment decisions. The location of the stone within the ureter affects how quickly it passes. Stones closer to the bladder tend to pass faster than those near the kidney. The lower ureter is wider and more flexible, making passage easier. Stones stuck in the upper ureter may take longer and cause more pain. Doctors may use imaging tests to determine the stone's exact location. Doctors use imaging tests like ultrasound, CT scans, or X-rays to locate kidney stones and assess their size. These tests help determine the best treatment approach and monitor the stone's progress. Imaging is especially important if symptoms worsen or if the stone does not pass within the expected time frame. Certain medications can help facilitate the passage of kidney stones. Alpha blockers, such as tamsulosin, relax the muscles in the ureter, making it easier for stones to move. These medications are often prescribed for stones between 5 and 10 millimeters. They can reduce pain and increase the likelihood of spontaneous passage. Shockwave lithotripsy is a non-invasive procedure that uses sound waves to break kidney stones into smaller pieces. These fragments can then pass more easily through the ureter. The procedure is typically used for stones that are too large to pass on their own but are not suitable for surgery. Recovery is usually quick, and most patients can return to normal activities within a few days. For stones that cannot be passed or broken up with shock waves, surgery may be required. Procedures include ureteroscopy, where a small scope is inserted into the ureter to remove the stone, and percutaneous nephrolithotomy, which involves removing the stone through a small incision in the back. Surgery is reserved for complicated cases and is generally safe when performed by experienced surgeons. Once a kidney stone has passed, most patients experience immediate relief from pain. Recovery involves monitoring for any residual symptoms, such as blood in the urine or mild discomfort. Doctors may recommend follow-up tests to ensure no stones remain and to check kidney function. Staying hydrated and following dietary advice can help prevent future stones. Prevention is key to avoiding future kidney stones. Doctors recommend drinking plenty of water, reducing salt and animal protein intake, and avoiding foods high in oxalate, such as spinach and nuts. Maintaining a healthy weight and following medical advice can significantly reduce the risk of recurrence. Regular checkups help monitor kidney health and catch any issues early. A balanced diet can help prevent kidney stones. Doctors suggest limiting salt, animal protein, and foods rich in oxalate. Increasing intake of fruits and vegetables, especially those high in citrate, can help inhibit stone formation. Calcium-rich foods are important, but supplements should be used cautiously. Always consult a healthcare provider before making major dietary changes. Citrate, found in citrus fruits like lemons and oranges, helps prevent kidney stones by binding with calcium and inhibiting crystal formation. Doctors often recommend drinking lemonade or adding lemon juice to water as a natural preventive measure. Citrate supplements may also be prescribed for patients with recurrent stones. Contrary to popular belief, dietary calcium can help prevent kidney stones. Calcium binds with oxalate in the gut, reducing the risk of stone formation. However, excessive calcium supplements may increase the risk. It's important to get calcium from food sources and follow your doctor's recommendations. Foods high in oxalate, such as spinach, nuts, and chocolate, can increase the risk of kidney stones. Doctors recommend limiting these foods, especially for patients with a history of stones. Pairing oxalate-rich foods with calcium can help reduce absorption and lower risk. High salt and animal protein intake can increase the risk of kidney stones. Salt raises calcium levels in urine, while animal protein increases uric acid and lowers citrate. Doctors recommend reducing salt and moderating protein consumption to prevent stone formation. Doctors advise drinking enough fluids to produce at least 2 liters of urine per day. This helps dilute minerals and prevents stone formation. Water is the best choice, but other fluids like lemonade or orange juice can also be beneficial. Avoid sugary drinks and sodas, which may increase risk. Regular physical activity can help prevent kidney stones by promoting overall health and maintaining a healthy weight. Exercise also improves circulation and kidney function. Doctors recommend at least 30 minutes of moderate activity most days of the week. Always consult your healthcare provider before starting a new exercise routine. There are several types of kidney stones, including calcium oxalate, calcium phosphate, uric acid, and struvite stones. Each type has different risk factors and dietary recommendations. Doctors may analyze past stones to determine their composition and tailor prevention strategies accordingly. Genetics can play a role in kidney stone formation. Some people are more prone to stones due to inherited traits. Family history increases risk, and doctors may recommend more frequent monitoring for those with a genetic predisposition. Lifestyle changes can still help reduce risk, even for those with genetic factors. Certain medical conditions, such as gout, hyperparathyroidism, and urinary tract infections, can increase the risk of kidney stones. Managing these conditions is important for prevention. Doctors may recommend additional tests or treatments for patients with underlying health issues. Kidney stones can recur, especially if risk factors are not addressed. Recurrence rates are high, with up to 50% of patients experiencing another stone within 5 years. Preventive strategies, including hydration, dietary changes, and regular monitoring, are essential to reduce recurrence. Regular checkups and kidney function tests help monitor kidney health and detect stones early. Doctors may use urine and blood tests to assess mineral levels and identify risk factors. Early detection allows for prompt treatment and reduces the risk of complications. Complications from kidney stones include infection, blockage, and kidney damage. Severe cases may require hospitalization and intensive treatment. Recognizing symptoms early and seeking medical care can prevent complications and ensure a safe recovery. Kidney stones can affect children, though less commonly than adults. Symptoms and treatment are similar, but prevention strategies may differ. Doctors focus on hydration, dietary changes, and monitoring for underlying conditions. Early intervention is important for children to prevent long-term kidney issues. Pregnant women can develop kidney stones, which may complicate pregnancy. Treatment focuses on pain management and hydration, with surgery reserved for severe cases. Doctors monitor both mother and baby closely to ensure safety. Prevention strategies include maintaining hydration and following dietary advice. Elderly patients may face additional challenges with kidney stones due to age-related changes in kidney function and other health issues. Treatment may be adjusted to account for frailty and comorbidities. Prevention remains important, with a focus on hydration, diet, and regular medical monitoring. Pain from kidney stones often comes in waves, known as renal colic. The pain may shift from the back to the lower abdomen as the stone moves. Understanding pain patterns can help patients anticipate symptoms and manage discomfort. Doctors use pain patterns to assess stone movement and guide treatment. Blood in the urine, or hematuria, is a common symptom of kidney stones. It occurs when the stone irritates the lining of the ureter. The amount of blood can vary, and it may be visible or detected only through tests. If blood persists after the stone passes, consult a doctor for further evaluation. Passing a kidney stone can cause changes in urination, including increased frequency, urgency, or difficulty. These symptoms usually resolve after the stone passes. Persistent urinary changes may indicate complications and should be evaluated by a healthcare provider. After passing a stone, doctors may analyze its composition to determine the cause and guide prevention. Patients are often asked to collect the stone for laboratory analysis. Results help tailor dietary and medical recommendations to reduce recurrence. Follow-up care is important after passing a kidney stone. Doctors may schedule repeat imaging or urine tests to check for residual stones and monitor kidney function. Ongoing prevention strategies, including hydration and dietary changes, are reinforced during follow-up visits. Making lifestyle adjustments can help prevent kidney stones and improve overall health. These include staying hydrated, eating a balanced diet, exercising regularly, and avoiding excessive salt and animal protein. Small changes can make a big difference in reducing stone risk. Passing a kidney stone can be emotionally challenging. Anxiety, stress, and frustration are common, especially during painful episodes. Support from family, friends, and healthcare providers can help patients cope. Mental health is an important aspect of recovery and prevention. In summary, the time it takes to pass a kidney stone from the ureter depends on several factors, including size, location, hydration, and overall health. Small stones may pass in days to weeks, while larger stones can take longer or require medical intervention. Recognizing symptoms, staying hydrated, and following medical advice are key to a safe and successful passage. The key takeaways are to stay hydrated, monitor symptoms, and seek medical attention when needed. Prevention strategies, including dietary changes and regular checkups, can reduce the risk of future stones. Understanding the passage timeline helps set realistic expectations and ensures timely intervention. Passing a kidney stone can be a challenging experience, but understanding the process and timeline can help you manage symptoms and make informed decisions. Always consult your healthcare provider for personalized advice and treatment. With proper care, most patients recover fully and can take steps to prevent future stones.